I'll hand it right over to Bradley Schwartz. Thank you for joining us.
Good morning, everybody. It's everybody can hear me, right? It's good to be here, and it's good to hear the perspective from the ER. I come at it from a little bit different. I come at it from a patient who went to the emergency room expecting to receive proper care. And I'd like to start out by just saying that I grew up in a household that was not opposed to medicine, for example. My grandfather, who I'm named after, my name is Louis Bradley Schwartz, L. Bradley Schwartz. He was Dr. Louis Bradley Schwartz, and he was the Marcus Welby back in the 50s who did house calls. And I just grew up knowing the importance of medicine and knowing the importance of the doctor-patient relationship. And I always had great relationships with my physicians, my internists, and I was never afraid to seek care. It was embedded in me from day one. And, my parents wanted me to go to law school, but it was apparent at an early age that really that wasn't going to be in the cards for me. So the next move was my dad telling me, son, you could do whatever you want in your entire life after you graduate from law school. He wanted me to be a professional, and I followed his great advice. And I went to law school, and I became a lawyer in 1991. And I had no idea what I wanted to do after I became an attorney. And I looked around a little bit, and frankly, I took the first job that I was offered. And it turns out that I started working for a group of insurance companies that were very, very aggressive in terms of defending claims. It exposed me to the legal profession, the legal field, within a real short period of time. I was trying big cases. Went from defending people that were injured or allegedly injured in car accidents, small little soft tissue whiplash cases, to, within 10 years, I had my own law firm, and we were defending just about everything, anything that came our way. Insurance companies loved our approach. We were good trial lawyers, and a lot of the stuff turned into medical type related litigation. I became exposed right off the bat to the inner workings of the medical system through lawsuits and litigation, because when people get involved in car accidents, for example, they go to doctors. And the cases that I was involved in, I told you I was working for insurance companies. So when people would file lawsuits, they'd be claiming that they were hurt. They'd report it to their insurance company, their auto insurance company, for example. That auto insurance company, once they got the claim, they looked at it, they said, we're not going to pay this. They would send it out to a law firm. And a lot of the times that it became us. We were one of the big players that were defending all of these cases. And it brought us into contact with a lot of physicians, because like any lawsuit, you have to go through discovery, you take depositions, people get sworn in under oath, and they're asked questions. And I think that it becomes important for me to say that to all of you, because it's along the lines of what I alluded to at the outset. I was comfortable going to a hospital, and I was the type of person that, based on my familiarity, based on my involvement with the legal process and the medical depositions and all the trial work that I did, I was not afraid at all even though I wasn't a doctor, even though I had no medical experience, I felt comfortable speaking to physicians and speaking to medical professionals. I know that I certainly had and still do have more medical knowledge than your average layperson. And it just gives you a certain level of confidence, knowing that, you're going to make a decision, you're going to go to a hospital, and you're going to tell somebody what's wrong with you. You're not going to hide it. And in May of 2004, that's where I found myself. The story goes like this. It was a beautiful, beautiful Saturday afternoon, and it fell on a Mother's Day weekend. I wasn't feeling good at all, and it was unlike me to be, moping around, feeling lethargic, not being able to move, and having an increasing headache. And it was extremely out of the ordinary for me to be acting like that, not only on Mother's Day weekend, but also this event where I was not feeling well coincided with my wife's 40th birthday. So I'm a 37-year-old guy, not feeling good on Mother's Day, not feeling good on the wife's birthday, and that wasn't going over very well for good reason. But I just wasn't feeling well. And my wife, eventually said to me, well, if you're not feeling good, maybe we should go to the hospital. And I thought that was a good idea. Her mom was a nurse. She called her mom. They did, maybe check my pulse or whatever. But my symptoms at that point in time were just no energy, couldn't move, and this headache that just wouldn't go away. So called 911 and took an ambulance to the emergency room, which was a good mile away from where I was living. And I already said it was a holiday. It was Mother's Day weekend. It appeared that a lot of the staff at the ER that day, and it wasn't very busy, but it just, it appeared like maybe a lot of people had taken the day off to go spend that quality time with the family on this beautiful May afternoon. I get triaged, I get examined. First thing that's always done is blood is drawn. I've since learned that when blood is drawn in the ER, you don't even have to note it as a stat order. It's stat by default if it's coming from the ER, and generally that means that if blood is drawn, it's going to come back within 45 minutes to an hour, and if the results don't come back, it's probably some sort of an issue that should be addressed. And in my case, the blood was drawn and the labs did come back. But the problem is I had some substitutes that were in the ER that day. I had an ICU resident who was communicating with the ER, who was designated, I found this out later, but he wasn't an employee, he was a moonlighter. There was a new electronic medical record system that was recently been implemented, and I think the people that were employees and who were familiar with it knew how to use it. But when you've got temporary people who are filling in gaps, not everybody was completely familiar with how this new system was working. This is back in 2004. So I said the labs did come back, but they came back during a shift change. They came back and nobody looked at them. I got to the ER on about 5:30 in the afternoon. The labs were back within that 45 minutes to an hour. They were showing panic levels across the board. It wasn't really acted on. I sat in that emergency room, not only by myself, but within a half an hour of me arriving, I had friends and family that were there with me. I had probably 5 or 6 people in the room, all doing their part to try and get somebody to pay attention to me. They were doing everything that they could, asking around, hey, is the doctor going to come in here? Hey, how come we haven't seen anybody in a while? But, and me, I already told you, my comfort level, I have a mouth on me, and I wasn't the type of person that's going to go into an emergency room and then just, keep my mouth shut and not try and advocate for myself. But I will say that when something like this happens to you, when you become the patient, everything that you know about how you're supposed to act just goes completely out the window. You freeze, you become a victim. I've since come to the conclusion that everybody that graduates from medical school should be almost required to do an extra month-long worth of training as an inpatient in a hospital in a gown, being at the beck and call and at the whim of people who are there supposedly to attend to your needs, because I think that perspective is important. The bottom line is that nobody knew it at the time, but I entered into this hospital pre-septic. I had bacterial meningitis that had broken through the blood barrier. If they would have acted in time, they would have taken the culture. They would have figured out what was wrong with me. They would have started me on a broad spectrum antibiotic, waiting to find out what the underlying infection was, but none of that happened. And by the time anybody figured anything out, it was midnight. And it was another shift change. And the only reason that I got the care finally, after realistically 8 hours of no care whatsoever, going from, a headache to pre-septic to full-blown septic shock, multi-system organ failure, immediately spiking a fever of 105 degrees, being immediately dumped off at the ICU, intubated, put on life support. None of that needed to happen. None of it needed to happen because, I know every hospital and every emergency room pretty much universally has the same equipment. They all have X-ray machines, MRI machines, a lab, syringes to draw blood, antibiotics that they can access and administer. But this is a people problem, and it was a systemic problem. It was a lack of communication. It was the Swiss cheese syndrome, which is, if you know about it, and if you don't, Swiss cheese has holes in it. And you think of the image of like a whole bunch of Swiss cheese being sliced and then arranging them perfectly so that there's gaps and things can get through those holes. That's what happened to me. Everything that could have gone wrong did go wrong. I ended up waking up from that coma about a month later. I didn't know any of these communication errors that had occurred. I knew I went to the hospital for care, but when I woke up, the doctors told me how lucky I was to be alive. They saved me. And the next thing that they told me was, well, you're blind in one eye. Thank God you don't have brain damage, but you are going to be losing all four of your limbs. And I did. I have amputations at all 4 of my extremities. But I went back. I went through a year's worth of physical rehabilitation. And then I said to myself, now what? I've been defending insurance companies and working for insurance companies for 15 years before this happened to me. And, you know, if it happened to me, it could happen to anybody. I figured I could better find a way to use what happened to me to benefit other people so it doesn't happen to them. And I'm thinking, boy, oh boy, this is a perfect opportunity for me to switch my practice, my legal practice from being a defense lawyer working for the insurance companies. Now I can go work for the patients, and I would love to be a medical malpractice lawyer. And if you think about it, I'm like the perfect guy to do it at this time, because I've got all the trial experience, and now I'm like the victim. And you would think that the patients and families who are having trouble with a hospital or a doctor and they've been harmed, they would reach out to me. And I was right. They did, and they did all the time, like crazy. My phone rings off the hook. Everybody, and I know a lot of people on this call have animosity toward lawyers, and in particular trial attorneys that represent medical malpractice victims or plaintiffs. And I get it. I was like that too for a long time. Take a breath, because out of all those calls that I received from all of these people that were complaining about the horrible things that happened to them in hospitals, I think maybe 2 of them turned into a viable case. And the reason is because these cases aren't easy. They take a lot of time and effort and money, and you know, lawyers don't like to take cases that they're going to lose, and that's for another story. So most of the time medical malpractice cases do get turned down. But the whole point of it is I'm fielding these calls, and I'm telling you, from the minute I walk into the office until the minute I leave, people are calling me with horrific problems about hospitals, doctors, emergency rooms, you name it. And law can't fix it. So I've tried to figure out, what the hell else am I going to do about it? And like you guys, I mean, this is where, you know, I feel we are so completely aligned in terms of taking what we know, taking what we've seen as being wrong and deficient about the system, and trying to find out what we can do about it. Now, I come about it from a different angle. I come about it from a patient, and as a lawyer, realizing that, you know, you get screwed as a patient, and most of the time a lawyer can't help you. So I started to figure out what else can be done, and I found out that it wasn't just me. You know, there were a community of nurses, social workers, discharge planners, case managers, back about 12 years ago or so, when I started investigating this, and they've gotten frustrated working within healthcare themselves, and they have gone off and decided that they're going to take the skills and the knowledge that they've learned working in the clinical environment, and yes, even the administrative environment, and use that for the benefit of patients. And they've gone independent, and they call themselves independent patient advocates. And that became something that I got very interested in and very intrigued with, because this was a group of people very similar to what I heard earlier, people who entered healthcare for all the right reasons. And once they were in it, they realized that there were systemic barriers in place that prevented them from doing what they wanted to do, why they entered the field in the first place, which was to treat patients and do good. So they left, and they've gone independent. Problem was, nobody knew who the hell they were, what they were capable of doing. That became my life mission. If you could look at the sign behind me that says medical error is the 3rd leading cause of death in the United States, and patient advocates can help save lives, I agree with that. I go back to my experience in the emergency room, and I know damn well that if I would have had somebody qualified, competent, who knew the lingo, maybe knew how ERs work and how they function, and know when shift changes occur, and know who's been there and who hasn't for a long time, who's not familiar. I mean, think about it. I always view like an ER or a law firm, or even like an auto body mechanic shop or a football team, whatever you want to call it, you got to jive with your team. And if you don't know who your team is, things are going to fall through the cracks. So I understand the need for emergency medicine to be taken back by the emergency physicians that practice, because you guys want to do your job and you don't want the barriers to prevent you from doing it. What I heard about also this morning before I started to speak is the reality that this cannot be done alone. Good luck, ER doctors, unionizing or whatever and getting in front of some federal governmental agency and passing a law. I mean, we live in an environment where the mantra is keep the government out of my healthcare. But we do need to work together. My mission is to make sure that the physician-patient relationship and the communication needs to take place actually does. I believe that there are so many doctors and nurses and even some administrators out there who really want to do the right thing, but the system is preventing them. And while I believe that all of this organization is necessary, all of the studies, all of the numbers, we all know about them, all of the top-down talk about patient safety and patient-centered this and patient outcomes, it's all fine and good. But it's just my belief that in order to keep patients safe at this particular time in the history of our country, the only way to do it is to have somebody there with you by your side that can make sure that the inevitable, everything that could go wrong, doesn't go wrong. We're human beings. So that's why I really like what I heard about all the talk about partnership and that this thing needs to be, handled by multiple different organizations, faculties, interests. And I'm here to support what you're doing. I'd like you to know what I'm doing, because I think together we can definitely make hospitals safer. We could definitely get to the point where patients are treated and they're given the time that they deserve. Me, I know what happened. The paramedics asked me if I had any alcohol within the last 24 hours before I went into that hospital, and I told the truth. I said, and I already told you all this, that it was my wife's birthday party and I'd thrown a wine tasting party the night before. I shouldn't even call it a party, but a wine sipping event with cheese. It wasn't a kegger. We weren't playing beer pong and doing shots. But when I said those words, and that was the history that was given to me, that I gave at the ER, I didn't find out until way later until how that got translated and how it affected my treatment. Because me saying that I had sipped on a little bit of wine the night before at a wine tasting party got translated into otherwise healthy 37-year-old man with a history of drinking alcohol the night before, presenting with a headache. And that stuck with me from the minute I walked into the ER until the minute that I was dropped off 8 hours later with 105 fever at ICU and I was intubated. So I get it. I am so happy to hear that the ER in the emergency medicine community is stepping up. I have an organization called Greater National Advocates, and the website is gnanow.org. The entire goal of the organization is to partner with physicians, partner with facilities, and serve as that bridge, that communication gap between patients and those who are trying to treat them. These are people who understand the system and know how to break down the barriers. And just as we know now about the movement of take emergency medicine back, I think it's important for all of you to know that there are people that are definitely interested in working right alongside you, right alongside the patients. And if you hear of a patient advocate, open your arms to them and understand why they're there. And I'm not talking about the patient advocates that work for the hospitals, the ones that report to risk management. I'm talking about the independent patient advocates that used to work there, who've decided to do something about it, just like you guys are all trying to do something about your present situation. So with that, I would like to thank you all for having me. Obviously, if you have any questions, I'd be more than happy to answer them. I would love to see you guys in one of the breakout sections that I'm going to be hosting. More details about that, but thank you to Mitchell and everybody else that put this on. And I will just close very, very quickly by asking the question that if any of you thinks that what happened to me with this meningitis misdiagnosis, if it sounds familiar to you as it relates to the subject matter of this particular summit, you're right. Because what happened to me is pretty much the prologue to the rape of emergency medicine. It's the first story in there. It's about a death resulting from a completely misdiagnosis of bacterial meningitis. So I guess I'm here to bring it all home and bring it all full center and bring it back. So thank you all for having me. I really appreciate this.
Brad, thanks so much for sharing your story. And yeah, those who are familiar with the rape of emergency medicine, Dr. McNamara might go into that a little bit more, but there were, unfortunately, the corporate practice of in the early contract management groups really devalued quality patient care and would put a physician into a position where there honestly the quality was much like very far down the line. It was really about put a staff for a low cost in the emergency department. And in your case, it was more a Swiss cheese model. It's hard to deconstruct exactly. Was the ER doctor overburdened that night? But we know that you got a hospitalist, or you got a hospitalist, not a intensivist, until the morning, and that's when antibiotics were finally given quite a bit later. And something that's remarkable in my view is you are bringing together independent patient advocates, because the same way that physicians are hamstrung and held back in doing what they want to do, the patient advocates at the hospitals, who might even be named patient advocates, social workers and case managers, might still have to toe the party line. So I think there's something analogous here, that maybe we're actually all patient advocates, the vast majority of us, but we are all similarly silenced by corporate entities. So with that, thank you very much, Brad.